The emergency department at County General smelled like antiseptic and burnt coffee at 6 in the morning. Fluorescent lights hummed overhead, casting everything in pale white. The linoleum floors gleamed wet from the night cleaning crew, and somewhere down the corridor a monitor beeped in steady rhythm. Riley Morgan pushed a crash cart down the hallway. Her scrubs faded from too many washes, her ponytail pulled tight and precise. She moved with the kind of efficiency that came from repetition, each step measured, each turn exact. A nurse passed her going the opposite direction. "Hey, Riley, can you restock room 4 when you're done with that?" Riley nodded once. The nurse, Jessica, turned to her companion without lowering her voice. "She's good at the grunt work, at least. Quiet as a mouse, though." They kept walking. Riley's expression didn't change. She'd been at County General for 11 months now. 11 months of restocking supplies, of running labs to different floors, of being the one who showed up early and left late without complaint. They thought she was shy. They thought she was simple. She let them think it. At the nurse's station, Dr. Marcus Webb flipped through patient charts without looking up. He was in his mid-40s, confident in the way doctors who'd never been wrong often were. "Riley, I need you to run these labs up to 3rd floor, and grab me a coffee on your way back." His tone was absent, automatic. Riley stopped beside the desk. "Black, 2 sugars." He glanced up, mildly surprised. "You remember?" "Yes." She took the labs and left. Behind her, she heard Webb mutter to a resident, "At least she follows directions." The resident laughed softly. Riley kept walking. In the supply closet on the 2nd floor, her hands moved with mechanical precision. Gauze packs stacked in perfect rows. Saline bags hung with labels facing out. IV catheters sorted by gauge, each box aligned. Her fingers paused on a roll of Israeli bandages. Wrong aisle for a civilian hospital. She stared at it for 3 seconds, then placed it back on the shelf slowly, carefully, like it might detonate. The door opened behind her. Another tech poked his head in. "You almost done? We need someone to help with the transfer in Bay 3. 2 minutes. He left. Riley exhaled through her nose, counted to 5 in silence, and finished restocking. A code blue rang overhead as she emerged into the hallway. "Room 9, I need hands now." Riley was first through the door. An elderly man lay on the gurney, skin ashen, lips blue. No chest rise. The monitor showed a flat line, struggling to find rhythm. Jessica fumbled with the defibrillator, hands shaking slightly. "Charging. Wait, it's not. Why isn't it?" Riley's hand moved before she thought about it. She reached past Jessica and flipped the switch they always forgot, the one tucked behind the power button. The machine beeped to life. "Oh." Jessica didn't look at her. "Thanks." Dr. Webb burst through the door, pulling on gloves. "What do we have?" "Asystole, no pulse, approximately 90 seconds down." "Clear." Webb placed the paddles. The man's chest arced off the table. Nothing. Again. "Clear." Another shock. The monitor flickered, then beeped. A rhythm. Weak, but there. Webb exhaled. "Okay, good. Let's get him stabilized and up to ICU." He looked around the room, eyes passing over Riley like she was part of the equipment. "Nice work, everyone." Riley stepped back into the corner as the team swarmed the patient. She watched them work for another 30 seconds, then slipped out quietly. No one noticed her leave. In the locker room during her break, Riley sat on the bench and opened her bag. Inside, a protein bar, a water bottle, an extra pair of socks. Beneath the spare scrubs, tucked into a side pocket, was a small patch. Maroon background. Silver wings spreading from a caduceus wrapped around a sword. She touched it once with her index finger, then closed the bag and ate her protein bar in silence. The afternoon shift dragged. Riley restocked Trauma Bay 2, cleaned equipment in the procedure room, and ran samples to the lab 4 times. She spoke only when spoken to, and even then, only the minimum required. At the nurse's station, Jessica was talking to another nurse about weekend plans. "I swear, Riley's like a robot. She never talks, never smiles. It's kind of creepy." The other nurse laughed. "Maybe she's just boring. Or maybe she's got like no personality. I don't know. She's been here almost a year and I don't know a single thing about her." Riley walked past them carrying a bin of supplies. Neither stopped talking. In Trauma Bay 2, Riley methodically checked every drawer. Airway supplies, top left. Suction equipment, top right. IV start kits, middle drawer. Chest tube tray, bottom left. Everything exactly where it needed to be. Her hands moved without thought, muscle memory from another life. Another set of drawers that had held different supplies in dirtier places. She closed the last drawer and stood there for a moment, staring at nothing. Her phone buzzed in her pocket. She pulled it out. Unknown number. The message read, "Morgan, been a while. Heard you're stateside now. We should talk. Call me. Garrett." Riley read it twice, then deleted it. She slid the phone back into her pocket and returned to the hallway. Dr. Webb was reviewing scans on a monitor. He didn't look up as she passed, but he spoke anyway. "Riley, when you're done with Bay 2, the ambulance bay needs restocking. They went through a lot of supplies last night." "Okay. And check the oxygen tanks. Make sure they're all full." "Okay." He still hadn't looked at her. She walked away. At the end of her shift, Riley sat in her car in the parking lot for 10 minutes before starting the engine. The sun was setting, painting the sky in shades of orange and red that reminded her of things she didn't want to remember. She turned the key. The radio came on, some pop song she didn't know. She drove home in silence, the maroon patch still tucked in her bag, the deleted message still sitting in her recently deleted folder. At home, her apartment was small and clean. No pictures on the walls, no personal items on the shelves, just functional furniture and the basics. She made a simple dinner, ate it standing at the counter, and washed the single plate immediately after. Before bed, she opened her bag one more time. The patch was still there. She hadn't worn it in 4 years. She wouldn't wear it tomorrow either. Riley set her alarm for 5 in the morning and lay down in the dark, staring at the ceiling until sleep finally came, bringing with it dreams of sand and blood and the faces of people she couldn't save. The evening shift started the same way it always did. Riley clocked in at 6, changed into fresh scrubs, and began her rounds. The emergency department was quieter now, the usual daytime chaos settling into the low hum of monitoring equipment and distant conversations. She restocked the trauma bay first, her hands moving through the familiar motions. Gauze, tape, sterile drapes, each item placed with precision that no one would notice or appreciate. At 7:30, the ambulance doors opened. 2 paramedics wheeled in a gurney, moving fast but controlled. GSW to the shoulder, stable vitals but significant blood loss. Patients conscious, GCS 15. Riley was passing through the hallway when they rolled by. She caught the smell immediately. Copper and iron, thick in the air. But underneath it, something else. Something chemical and sharp that didn't belong in a suburban emergency room. Cordite, gunpowder residue. Her hands stopped mid-reach for a supply bin. The smell pulled her backward, through years and continents, to a place where that combination of scents meant something very different. Kandahar, summer of 2017. The explosion had turned the sky orange and filled the air with smoke that tasted like burning metal. Daniels was on the ground, his shoulder destroyed by shrapnel, screaming her name through clenched teeth. Her hands had moved without hesitation, tearing open his vest, packing the wound with whatever she could grab. His blood was hot against her fingers, pulsing with each heartbeat, and she'd pressed down hard enough to make him scream louder. "Stay with me, Daniels. Stay with me. You're not dying today. Look at me. Stay with me." His eyes had locked on hers, terrified and trusting in equal measure. She'd held pressure for 11 minutes until the medevac arrived, her hands cramping, her arms shaking from the effort, but never letting go, never easing up, because easing up meant he died, and she refused to let that happen. "Riley?" She blinked. Dr. Webb stood in front of her, frowning slightly. "You okay?" Her hands were gripping the edge of the supply cart, knuckles white. "Fine. You've been standing there for almost a minute." She released the cart and straightened. "Sorry." "I'm fine." He watched her for another moment, something shifting. Efting behind his eyes, a question he didn't ask. Then he turned away. "Room 6 needs cleaning when you get a chance." Riley nodded and walked in the opposite direction, away from the trauma bay, away from the smell. In the supply closet, she stood with her back against the door and breathed slowly, counting backwards from 10 in Pashto. Das, na, at, awa, shpag, salor, spin, dre, yow, siffer. Old habit from another life. It took 3 full cycles before her heartbeat settled. At 10 o'clock, she stepped outside for air. The parking lot was mostly empty, just a few scattered cars under flickering streetlights. The night was cool and still, the kind of quiet that felt heavy. Riley leaned against the brick wall and let her head fall back, eyes closed. A security guard walked past, keys jangling on his belt. "You good, miss?" "Yeah." He nodded and continued his rounds. Riley opened her eyes and looked down at her forearm. She tugged her sleeve down over the thin white scar that ran 3 inches along the inside of her arm. Barely visible unless you knew to look for it. Shrapnel. Helmand Province, 2019. She'd barely felt it at the time. Inside, the hallway near the nurse's station was busier now. A few doctors clustered around a computer, reviewing scans. Jessica stood nearby, talking to another nurse in a voice just loud enough to carry. "I'm telling you, there's something off about her. Riley. She's been here almost a year and she's like a ghost. Never talks about herself. Never goes to any of the staff events. It's weird." The other nurse shrugged. "Maybe she's just private." "Private is one thing. This is different. She's like a robot. No emotion, no personality. I don't even know if she has friends." Riley walked past them toward the medication room. Neither stopped talking. She unlocked the medication cabinet, verified the count on the controlled substances, and logged everything in the computer with mechanical precision. Her phone buzzed in her pocket. She ignored it. It buzzed again. She pulled it out. 2 messages from the same unknown number. "Morgan, it's Garrett. I know you saw the last message. We need to talk. It's important." Riley stared at the screen. Garrett. Staff Sergeant Michael Garrett. Signals Intel. They'd served together in Kandahar for 6 months before she'd rotated out. She opened the message thread, fingers hovering over the keyboard. Then she locked the phone and put it away. At 11, a call came over the radio. "Incoming, motor vehicle accident. ETA 4 minutes. 2 patients, 1 critical." Riley was in the hallway when Dr. Webb jogged past, already pulling on gloves. "Riley, I need trauma 2 prepped now. Full setup." She was moving before he finished the sentence. "Trauma Bay 2. She opened every drawer she'd organized earlier, pulled out airway supplies, suction equipment, IV kits, chest tube trays. Everything laid out in perfect rows, ready. Jessica came in behind her. "You need help?" "No." Riley checked the oxygen flow, tested the suction, verified the defibrillator was charged. 90 seconds, start to finish. Jessica watched her work with an expression that was hard to read. "You're fast." Riley didn't respond. The ambulance arrived. 2 patients. One was stable, walking wounded. The other was unconscious, a deep laceration across his chest, breathing shallow. Dr. Webb took command immediately. "Get him on the table. Someone get me vitals." BP 90/60. Heart rate 120. Respirations 22 and shallow. Webb examined the wound. "Looks superficial, but we need to rule out pneumothorax. Riley, get me a chest X-ray portable unit." She was already moving. The X-ray tech arrived 3 minutes later. Riley helped position the patient, her hands steady and sure, adjusting his arm to the correct angle without being asked. The tech glanced at her. "You've done this before." "A few times." The image came back clean. No collapsed lung. Webb exhaled in relief. "Okay, irrigate and suture. Jessica, you take this one, I'll check on the other patient." Jessica nodded and stepped forward. Riley stepped back into the shadows, watching quietly as Jessica worked. Competent, but slightly hesitant, her hands steady enough but not instinctive. After 20 minutes, the patient was stable and moved to observation. Jessica peeled off her gloves and tossed them in the bin. "God, I hate chest wounds. They always look worse than they are." Riley cleaned the bay in silence, wiping down surfaces, restocking. Stocking supplies, resetting everything to exactly how it was before. In the locker room at the end of her shift, Riley sat alone on the bench. She opened her bag. The maroon patch was still there, tucked beneath her spare scrubs. She pulled it out and held it in her palm. Maroon background, silver wings, caduceus and sword. Special Operations Combat Medic. She traced the edge with her thumb. Her phone buzzed again. Another message from Garrett. "Riley, I'm not trying to drag you back. I just thought you should know. Jenkins is in town. He's asking about you." Riley's jaw tightened. Jenkins. She hadn't heard that name in 4 years. She deleted the message, put the patch back in her bag, and left. 3:47 in the morning. Riley was restocking the crash cart in the hallway when the ambulance bay doors exploded open. The sound echoed through the emergency department like a gunshot. 2 paramedics burst through, faces tight with urgency, pushing a gurney at near-running speed. Multi-vehicle MVA on the highway, Class 1 hemorrhage, blood pressure dropping fast, GCS is falling, we need trauma now. Riley abandoned the cart and moved. The man on the gurney was maybe 30 years old, his face pale as paper, lips tinged blue. Blood soaked through the paramedics' gloved hands where they pressed against his upper thigh, dark and pulsing with each weak heartbeat. Dr. Webb appeared from the doctor's lounge, still pulling on his white coat. Get him to Trauma 1. What are we looking at? Femoral artery, we think. Can't get adequate pressure. Tried 2 tourniquets, but the injury's too high. He's been bleeding for at least 8 minutes, maybe longer. Too long. Riley knew it immediately. 8 minutes of arterial bleeding meant he'd lost close to half his blood volume already. They wheeled him into Trauma 1. Jessica was already there. Snapping on gloves, her face pale but focused. Get him on the table. Someone call surgery. No time, Webb said. We stabilize here. Get me pressure and a line in him now. The team moved like a machine, practiced but not smooth. There was hesitation in their movements, the kind that came from training rather than experience. Riley stood near the door, watching. The monitor screamed, BP 60 over nothing. He's circling the drain. Webb moved to the wound, pulling back the blood-soaked gauze. Fresh blood welled up immediately, pulsing dark red. Clamp, I need a clamp. Jessica handed it to him. He reached into the wound, hands shaking slightly, trying to find the vessel in the mess of torn tissue and pooling blood. Suction, I can't see anything. Jessica fumbled with the suction catheter, trying to clear the field, but the blood was coming too fast. I can't get it. There's too much. Keep trying. Riley stepped closer, her eyes tracking the blood flow, reading the anatomy beneath the chaos. She could see the problem from where she stood. The angle was wrong. He was working too distal, chasing the bleed instead of stopping it at the source. Doctor. Webb didn't look up. Not now, Riley. You need to go proximal. I am proximal. You're on the distal branch. The primary bleeder is higher, above the inguinal ligament. He shot her a glare, sweat beading on his forehead. I know where the femoral artery is. The monitor alarm intensified, pressure's dropping, 50 systolic. He's losing his pulse. Jessica's voice cracked. Doctor, we're losing him. Riley didn't ask permission this time. She moved forward, hands already rising, and stepped directly into Webb's space. What the hell are you? Her hands slid into the wound, not hesitant, not slow. Her fingers found the anatomy by touch alone, navigating through tissue and blood with the certainty of someone who'd done this in worse conditions, with worse lighting and people shooting at her. She pressed down, applying pressure in a specific location, 2 inches higher than where Webb had been working. The pulsing flow slowed, then stopped. Webb froze, staring at her hands. What are you doing? Proximal occlusion, manual compression above the inguinal ligament, directly on the external iliac. Her voice was calm. Clinical. Get your clamp ready. Medial to the femoral nerve, lateral to the vein. He didn't move. Now, doctor. The command in her voice snapped him out of it. He grabbed the clamp from the tray, hands steadier now, and positioned it where she indicated. There, just medial. He placed the clamp. The jaws closed with a soft FT click. Riley shifted her hand, releasing pressure slowly, checking. No bleeding. The clamp held. Silence dropped over the room like a curtain. The monitor's alarm faded. The frantic beeping slowed, steadied. 70 systolic. 80. 90. Jessica exhaled, a sound between a gasp and a sob. Oh my God. Webb stared at the surgical field, then at Riley's blood-covered hands, then at her face. Where did you learn that? Riley pulled her hands free and stripped off gloves that weren't hers. Anatomy class. That's not an anatomy class technique. That's field trauma surgery. She walked to the sink and began washing her hands, methodical and thorough. He's stable now. You should get him to OR for definitive repair. Riley. Webb's voice was different now, sharper. How did you know exactly where to compress? She dried her hands on a paper towel. The angle of the blood flow indicated a proximal source. Basic physics. That wasn't basic anything. Jessica was staring at her, eyes wide. Riley, that was incredible. I've never seen anyone just reach in like that, and I need to finish restocking. Riley dropped the towel in the bin and walked toward the door. Webb stepped into her path. Wait, just wait. She stopped. He studied her face, really looked at her for what might have been the first time in 11 months. Who are you? I'm Miley Morgan. I work here. That's not what I'm asking. She met his eyes, and for just a moment, something flickered in her expression. Something hard and distant and far older than her 32 years. Then it was gone. I restocked the crash cart in the hallway. Someone should move it back to Bay 3. She walked out. Weck didn't stop her this time. In the hallway, Riley's hands were steady as she pushed the crash cart back into position. No tremor, no shake. They never shook anymore. Behind her, she could hear Webb and Jessica talking in low, urgent voices, but she didn't stop to listen. In the supply closet, she stood alone in the dark for 60 seconds, breathing slowly, counting in Pashti again, letting the adrenaline bleed out of her system the way she'd been trained. When she emerged, her face was calm. At the nurse's station, Jessica caught her arm. Riley, seriously, that was amazing. How did you stay so calm? Riley looked down at the hand on her arm until Jessica released it. He needed help. I helped. But where did you learn to do that? I've been a trauma nurse for 6 years and I've never seen anyone just dive in like that. I read a lot. Jessica laughed, but it died quickly when Riley didn't smile back. You're serious. Riley walked away without answering. At 4:30, Dr. Webb found her in the medication room doing inventory. He closed the door behind him. I called the OR. They said the repair went perfectly. The vascular surgeon said whoever did the initial compression saved that man's life. Another 2 minutes and he would have arrested. Riley continued counting pills. That's good. He also said the technique you used isn't taught in civilian medical training. She logged a number in the computer. Riley, I need you to be straight with me. Where did you learn field trauma surgery? She closed the medication cabinet and locked it. I should get back to work. You just saved a man's life with a technique I've only read about in military medical journals. I think I deserve an answer. She turned to face him, her expression unreadable. You're right, you do. He waited. But not tonight. She walked past him and out the door, leaving him standing alone in the medication room with more questions than he'd started with. 6 in the morning. Shift change. The emergency department was transitioning from night chaos to day routine. Nurses and doctors exchanging reports in clusters throughout the hallway. Riley stood at the nurses' station, filling out restocking logs with mechanical precision. Her handwriting was small and exact. Each letter formed identically to the last. The front doors opened. A man walked in, maybe mid-40s, wearing jeans and a plain jacket. His hair was military short, graying at the temples, and he moved with the kind of posture that never fully left even years after service. A veteran's cap sat on his head. 75th Ranger Regiment. He stopped just inside the entrance, scanning the room slowly, methodically. His eyes landed on Riley. He went completely still. Then he started walking toward her. Riley kept writing, pen moving across the paper without. Pause. Morgan? Her pen stopped. Riley Morgan? She looked up slowly. Her face showed nothing. I'm sorry. Do I know you? He stepped closer, studying her features like he was comparing them to a photograph in his memory. You were attached to our unit. Kandahar, 2017. 18th Airborne. You ran medical support for 3 months during the summer offensive. Jessica was standing nearby, pretending not to listen, but absolutely listening. Riley's voice was calm. I think you have me confused with someone else. No. He shook his head, certain. I watched you put a chest tube in a guy with a sucking chest wound in the back of a moving Humvee while we were taking fire. Your hands didn't shake once. Dr. Webb had stopped mid-conversation with a resident. He was watching now. So was half the department. Riley set down her pen carefully. Sir, I've never served in the military. Sergeant Morgan. His voice dropped lower, more insistent. You saved my life in a field hospital outside Kabul after an IED tore through our convoy. I lost half my leg. You told me I was going to make it home, and you made damn sure I did. The hallway had gone quiet. Riley stood slowly, maintaining eye contact. You're mistaken. You had a patch, he continued, not backing down. Maroon background, silver wings, caduceus wrapped around a sword. You wore it on your plate carrier, right side, just below your name tape. Her breathing didn't change, but something shifted behind her eyes. And you hummed when you worked, he added, softer now. Old country songs, Johnny Cash mostly. You didn't even realize you were doing it. Jessica's mouth fell open slightly. Dr. Webb took a step closer. Riley, is this true? She didn't answer. The veteran moved closer, his expression gentler now. You told me your name was Morgan, said you'd been doing combat medicine for about 6 years at that point. You were the best medic I ever saw, bar none. Riley's hands were flat on the desk, fingers spread. I need to get back to work. I came here for a follow-up appointment, he said. Saw your name on the staff directory in the lobby. I had to know if it was really you. It's not. It is. She turned to walk away. Sergeant Morgan. The command in his voice cut through the space like a blade. Riley stopped. She didn't mean to. It was pure reflex. Muscle memory from 8 years of responding to rank and authority. Everyone saw it. The veteran saw it too. His expression shifted to something like vindication mixed with respect. You still respond to it. Riley closed her eyes for a brief moment. When she opened them, Dr. Webb was standing directly in front of her. Riley, his voice was quiet but firm. Is what he's saying true? The entire department was watching now. Nurses, doctors, techs, even a patient in a wheelchair waiting for discharge. She looked at Webb, then at Jessica, then at the dozen other faces staring at her. Finally, she looked back at the veteran. He gave her a small nod, something understanding in his eyes. Riley exhaled slowly through her nose. Yes. The single word fell into the silence like a stone into still water. Jessica actually gasped. Webb's expression went through several rapid changes. Confusion, shock, realization. Riley's voice was steady, clinical. My name is Riley Morgan. I served as a Special Operations Combat Medic with the United States Army for 8 years. I was honorably discharged 4 years ago. Nobody moved. I didn't lie on my employment application. All my credentials are legitimate. I simply didn't include my full service record because it wasn't required. Dr. Webb shook his head slowly, like he was trying to reorganize his entire understanding of reality. You've been restocking supplies for 11 months. Yes. You saved that man last night using a technique I've only seen in military trauma journals. Yes. Why didn't you say anything? Riley met his eyes directly. Because I didn't want this. She gestured at the room, at all the staring faces. The veteran spoke up again. Ma'am, I didn't mean to out you. I just needed to know. You saved my life. I wanted to thank you properly. Riley's expression softened slightly. You don't need to thank me. I was doing my job. You went above and beyond your job. You sat with me for 4 hours while we waited for medevac because the LZ was too hot. You kept talking to me, keeping me conscious, even when command said to prioritize other casualties. I prioritized the one who needed it most. You prioritized all of us. He pulled up his pant leg, revealing an advanced prosthetic. I'm walking because of you. I'm here because of you. Riley looked at the prosthetic, and something flickered across her face. Memory, maybe, or pain. Jessica found her voice. Riley, why didn't you tell us? We could have used someone with your experience. We've been treating you like... She stopped herself, but everyone knew what she was about to say. Like you were nobody. Doctor. Webb ran a hand through his hair. 8 years, special operations. How many combat deployments? 4. 4, he repeated, like the word didn't make sense. And you've been here almost a year, running labs and restocking supplies, and you never said a word. I didn't need to. Didn't need to? His voice rose slightly. Riley, you're probably more qualified than half my attending staff. Qualifications are different in combat medicine. Not that different. He was staring at her like he'd never seen her before. Last night you performed a trauma procedure that most civilian doctors couldn't do. Where did you serve? Kandahar, Helmand Province, Kabul, Bagram. Each location dropped like a hammer. Jessica was shaking her head. Oh my God. Riley, I said, we all said such terrible things about you. Riley's voice was gentle. You didn't know. We should have treated you better anyway. You treated me exactly how I wanted to be treated. Like I was nobody special. The veteran stepped forward again. Ma'am, you are special. What you did for us, for all of us over there. I did my job, Riley interrupted quietly. Same as you did yours. Not the same. He extended his hand. Staff Sergeant David Chen, retired. And I owe you my life. Riley looked at his hand for a moment, then shook it. You don't owe me anything, Sergeant Chen. I disagree, ma'am, respectfully. A small smile touched the corner of Riley's mouth. There, and gone in an instant. Noted. Dr. Webb was still processing, his mind visibly racing. We need to talk, officially, about your role here, about what you can do. The radio on the wall crackled to life. All available personnel, mass casualty event, building collapse downtown. Initial reports indicate 12 victims, multiple critical. ETA 3 minutes. Riley's entire demeanor changed. Her spine straightened, her shoulders squared. The quiet, invisible woman who'd spent 11 months in the background disappeared, replaced by something else entirely. How many trauma bays do we have ready? Her voice carried command now, clear and absolute. Webb blinked. 3, maybe 4. Get 6 ready. If there are 12 victims, at least half will need immediate intervention. Jessica, I need you to set up a triage station at the ambulance bay entrance. Color code incoming patients. Red, yellow, green. Jessica nodded automatically, then caught herself. Wait, Now, Jessica. Jessica moved. Riley turned to Webb. I need your permission to take operational command of triage and initial stabilization. He stared at her. Doctor, I need an answer. People are dying. Yes, do it. Riley was already moving toward the ambulance bay, her voice carrying across the department. I need all available nurses and techs staged at trauma bays 1 through 6. Doctors, be ready to take handoff from me on critical patients. Move. The department exploded into motion, and Riley Morgan, who'd been invisible for 11 months, was suddenly the only person anyone could see. The first ambulance arrived 90 seconds later. Riley stood at the entrance to the ambulance bay, hands clasped behind her back, eyes scanning the incoming gurney before the paramedics even spoke. Male, approximately 40, crush injury to chest. Decreased breath sounds on the right. Flail chest with probable pneumothorax. Trauma 1, move. She pointed and they moved. The second ambulance pulled in immediately behind. Female, mid-30s, compound fracture to the femur, significant blood loss. Trauma 2, get pressure on that leg and hang 2 units. Go. Third ambulance. Child, maybe 8 years old. Head trauma, GCS dropping. Riley's expression didn't change, but her voice sharpened. Trauma 3. Get me a pediatric airway kit and call neurosurgery now. Fourth ambulance. Fifth. Sixth. She triaged every patient in seconds, reading injuries with a glance, sending each to exactly where they needed to be. Her commands clear and absolute. Dr. Wedd stood near Trauma 1, watching her coordinate 12 incoming patients without notes, without hesitation, without a single wasted word. Jessica ran past, pushing a gurney. Riley, Trauma 4 needs help. The patient's crashing. Tension pneumothorax, needle decompression, second intercostal space, mid-clavicular line. Don't wait for imaging. I've never done one without supervision. You're doing one now. I'll be there in 30 seconds. Jessica's face went pale, but she nodded and kept moving. Riley turned to the next incoming patient, a teenage boy with a piece of rebar protruding from his abdomen. She didn't flinch. Trauma 5, do not remove the foreign object. Stabilize it in place and prep for OR immediately. He's going straight to surgery. The paramedics wheeled him through. A resident stood frozen near the doorway, staring at the chaos. Riley's voice cut through. Dr. Hayes, I need you in Trauma 1 assisting Dr. Webb. Move now. The resident startled into action. The flow was constant. Riley moved between bays, her hands working with mechanical precision. In Trauma 3, she intubated the child in under 30 seconds while a nurse held C-spine stabilization. In Trauma 4, she guided Jessica through the needle decompression, her voice calm and instructive, even as the patient's oxygen saturation climbed back into safe range. Good. You felt the pop, that's the pleura. Now secure it and get chest x-ray for tube placement. Jessica's hands were shaking, but she'd done it. Oh my God, it worked. It always works if you do it right. You did it right. In Trauma 2, an arterial bleed spurted across the room. Riley was there before anyone could call for help. Her hand went into the wound, found the vessel, applied pressure. Clamp, now. A nurse handed it to her. She placed it without looking. Muscle memory and anatomy knowledge combining into something that looked like instinct but was actually 8 years of repetition in worse conditions. The bleeding stopped. She moved to the next patient. Outside, the sound of helicopter rotors grew louder. Heavy rotors, military heavy. Dr. Webb looked up from the patient he was working on, frowning. We didn't call for air transport. The sound intensified, closer now, directly overhead. The building shook slightly as something large landed on the rooftop helipad. Riley's hands paused for just a fraction of a second, then continued working. Footsteps echoed down the stairwell. Multiple people, moving fast, boot heels striking tile in perfect rhythm. The door to the emergency department opened. 2 officers in army dress uniforms entered first, their bearing parade ground perfect, medals glinting under the fluorescent lights. Behind them, a woman in ACUs. Her uniform crisp despite the early hour, moving with the kind of authority that made people step aside without thinking about it. Her name tape read Hayes. Her rank insignia, Brigadier General. Dr. Webb straightened, confused. Can I help you? The lead officer, a colonel, scanned the room with practiced efficiency. We're looking for Sergeant Riley Morgan. Riley was elbow deep in a patient's chest wound, applying hemostatic gauze. She didn't look up. I'm in the middle of something. The general stepped forward, her voice carrying easily across the chaos. Sergeant Morgan, we need you to come with us. I have 12 critical patients. We have a situation that requires your specific expertise. Riley pressed the gauze into place, checked the bleeding, then stepped back and stripped off her gloves. With respect, ma'am, so do I. Dr. Webb found his voice. Excuse me, who are you and what gives you the right to walk into my emergency department? Brigadier General Sarah Hayes, United States Army Medical Command. Her tone was polite but immovable. And I'm not asking for your permission, Doctor. Sergeant Morgan is reserve status, and she's being recalled for an emergency medical consultation. Webb's face flushed. She's a civilian employee of this hospital. She's an IRR asset, the colonel corrected. Individual ready reserve. Her contract allows for recall in situations of national emergency or critical need. She's in the middle of treating patients. I can see that. General Hayes looked around the trauma bays, taking in the organized chaos, the efficient flow. Who established this triage system? Riley did, Jessica called from Trauma 4. Hayes nodded slowly. Effective, clean flow, minimal wasted movement. Textbook mass casualty. Tidy management. She looked back at Riley. You've been busy. Riley was washing her hands at the sink, methodical and thorough. What's the situation, ma'am? Chemical exposure at a civilian industrial site. Chlorine gas, possibly other agents. 12 victims, 3 critical. Local hospital is overwhelmed, and their staff isn't trained in chemical exposure protocols. You're the closest qualified medical asset. There are other combat medics, not with your level of certification, not within 200 miles. Dr. Webb stepped between them. You can't just take my staff. We're in the middle of a mass casualty event ourselves, which she's already stabilized, Hayes interrupted, not unkindly. Doctor, look around. Your department is functioning efficiently because Sergeant Morgan organized it. Your patients are alive because she knew exactly what to do. But there are 12 more people, 50 miles from here, who will die without specialized intervention. Then send someone else. Hayes's expression hardened slightly. There is no one else, not with her qualifications. Webb turned to Riley. You don't have to go. Riley dried her hands slowly. Actually, I do. The IRR contract is binding. We can fight it. Dr. Webb. Her voice was gentle but firm. Those people need help, specialized help. I can provide it. So can other people. General Hayes spoke again, her voice carrying the weight of absolute certainty. With respect, Doctor, no, they can't. Sergeant Morgan isn't just a combat medic. She's a Special Operations Combat Medic, Level 3 certified. She's trained in TCCC, ATLS, CBRN casualty management, and advanced trauma life support in austere conditions. The room had gone quiet. Everyone was listening now. Hayes continued, she's performed over 300 combat trauma surgeries in active fire zones. She's qualified in emergency thoracotomy, surgical cricothyroidotomy, and field amputation. She holds 2 Bronze Stars with Valor Device and a Silver Star for actions in Helmand Province, where she kept 43 soldiers alive. during a 6-hour engagement while her entire team was KIA. Complete silence. Jessica's face had gone white. Dr. Webb stared at Riley like he'd never seen her before. Staff Sergeant Chen, still standing near the nurse's station, came to attention. Hayes wasn't finished. So yes, doctor, I'm taking her. Because when it comes to keeping people alive in impossible conditions, there are fewer than 20 people in this country more qualified than Riley Morgan. And she's the only one available right now. Riley set down the paper towel. What's the timeline, ma'am? Wheels up in 5 minutes. Situation is deteriorating rapidly. Riley nodded once. I need 2 minutes to change and grab my gear. You have it. She turned toward the locker room, then stopped and looked back at Dr. Webb. The patients in trauma 1 through 6 are stable. Trauma 3 needs a CT scan in the next hour. Trauma 5 is going straight to OR. Trauma 2 will need vascular surgery consult. Jessica can coordinate the rest. Webb just nodded, speechless. Riley walked toward the locker room. Staff Sergeant Chen stepped into her path. He saluted, crisp and perfect. Riley stopped. For a moment, she hesitated. Then she returned the salute with the same precision. Thank you, Sergeant. Chen said quietly, You don't need to thank me. Yes, ma'am, I do. She held his eyes for a moment, then nodded and continued to the locker room. Jessica followed her. Riley, I don't even know what to say. Riley pulled her locker open, grabbed her bag. Don't say anything, just take care of the patients. I will, I promise. Jessica's voice cracked. I'm sorry for everything I said. I didn't know. You couldn't have known. Riley pulled out a small bundle wrapped in cloth. I didn't tell you. She unwrapped it. The maroon patch gleamed in the fluorescent light. Jessica stared. Is that? Yes. Riley attached it to her uniform with practiced movements. The muscle memory's still there after 4 years. She closed her locker and looked at Jessica. You're a good nurse. Trust yourself more. Then she walked out. General Hayes was waiting near the exit. She glanced at the patch on Riley's shoulder and nodded. Good to see you wearing that again, Sergeant. Good to be wearing it, ma'am. They walked toward the stairwell together, boot heels echoing in perfect sync. Behind them, County General Emergency Department continued functioning, organized and efficient. Efficient, following the system Riley had built in 15 minutes. Dr. Webb stood in the center of it all, watching her disappear through the doors, finally understanding exactly who had been restocking his supplies for the past 11 months. The Black Hawk lifted off 60 seconds later. Riley sat across from General Hayes in the cargo bay, the familiar vibration of the rotors settling into her bones like an old memory. The general watched her for a moment before speaking. You went dark after your discharge. Yes, ma'am. Complete communications blackout. Changed your phone number. Moved 3 times in 2 years. Didn't respond to any outreach from your former command. Riley looked out the window at the city falling away beneath them. I needed distance. From what? Riley didn't answer immediately. Hayes waited. She was good at waiting. The helicopter banked east, sunlight streaming through the windows. From everything, Riley said finally. From the noise, the expectations, the weight of it. You were one of the best we had. I know. Command wanted you to stay. They offered you promotion, training billets, whatever you wanted. I know that too. Hayes leaned forward slightly. So why leave? Riley's jaw tightened. She stared at her hands, turning them over slowly. There were scars there, thin white lines, barely visible unless you knew to look. I lost my team. The words came out flat, clinical. Hayes's expression didn't change, but something softened in her eyes. Helmand. Yes, ma'am. I read the after-action report. You held that aid station for 6 hours against overwhelming force. You kept 43 soldiers alive with limited supplies and no backup. I couldn't save the 4 that mattered most. Silence filled the cargo bay. Riley continued, her voice steady but distant. Martinez was first. Headshot. He was dead before he hit the ground. Nothing I could have done. She paused, breathing slowly. Chen took shrapnel to the femoral artery. I got the tourniquet on within 30 seconds. Textbook application, but the wound was too high, too close to the junction. He bled out anyway. Took 4 minutes. Her hands curled into loose fists. Daniels held on the longest. Chest wound, penetrating cardiac trauma. I had my hands inside his thoracic cavity, literally holding his heart together, keeping it pumping manually while we waited for medevac. Hayes was completely still, listening. He lasted 43 minutes. I felt his heart stop under my fingers, felt it struggle, weaken, and then just stop. Riley's voice didn't waver. They gave me a silver star for that day, called me a hero. She finally looked up at Hayes. I was the only one who walked out. My entire team died while I saved people I'd never met before. Martinez, Chen, Daniels, and Thompson. 4 people who trusted me to keep them alive, and I failed. You didn't fail. You were overwhelmed by superior force in an untenable position. I was their medic. Riley's voice carried an edge now. My job was to keep them alive. That was the only job that mattered, and I couldn't do it. Hayes was quiet for a long moment. Then she said, "That's not why you left, though." Riley's eyes narrowed slightly. "Ma'am, survivor's guilt would have driven you to work harder, train others, prevent future losses. But you didn't do that. You disappeared completely. Why?" Riley looked back out the window. "Because I realized something," she said quietly. "I was good at keeping people alive in war. I could work under fire, with minimal supplies, in the worst possible conditions. I could make life or death decisions in seconds and live with the consequences." She paused. "But I didn't know if I could do the same thing in peace, without the adrenaline, without the mission, without the structure. I didn't know if I was actually good at saving lives or just good at not dying. So you tested yourself. I walked away from everything I knew. Took a job where nobody knew my name or my record, became invisible. I wanted to see if I could still do the work when nobody was watching, when there were no medals or recognition. When it was just me and the patients. And could you?" Riley almost smiled. "For 11 months, yeah, I could. Until this morning. Until this morning." Hayes leaned back, studying Riley's face. "You know what I think?" "What's that, ma'am?" "I think you weren't testing whether you could do the work. You were punishing yourself for surviving when your team didn't." The words landed like a physical blow. Riley's expression went very still. "I think you felt like you didn't deserve to use your skills, didn't deserve recognition or authority, because you were alive and they weren't. So you buried yourself in the background, made yourself small, did the work nobody else wanted to do." Riley's breathing was controlled, measured. "Am I wrong?" Hayes asked gently. "No, man, you're not wrong." The helicopter began its descent. Below them, emergency vehicles clustered around an industrial complex, lights flashing, people in hazmat suits moving between buildings. Hayes stood, gripping the overhead strap. "Riley, you're the best combat medic I've ever seen, maybe the best anyone's seen. But being the best doesn't mean you can save everyone. I know that. Knowing it and accepting it are different things." Riley stood as well, checking her gear by instinct. "Yes, ma'am, they are." The helicopter touched down in a parking lot converted to a landing zone. Hayes moved to the door. "There are 12 people down there who need you, not because you're trying to prove something or punish yourself, because you have skills they need to survive." She pulled the door open. The sound of rotors intensified. "Can you do this?" Riley looked out at the scene. Organized chaos, scared people, overwhelmed medical staff. She thought about Martinez, Chen, Daniels, Thompson. She thought about the Nan with the femoral bleed, the child with the head trauma, the 43 soldiers in Helmand. She thought about 11 months of restocking supplies and being invisible. Then she stepped toward the door. "Yes, ma'am, I can do this." They climbed out into controlled chaos. A man in a fire chief's uniform approached immediately. "General Hayes? Thank God. We have 12 victims with chemical exposure. Chlorine gas primarily, but possibly mixed agents. 3 are critical, respiratory distress and potential pulmonary edema. Our medics aren't trained for this level of care." Hayes gestured to Riley. "This is Sergeant Morgan. She's your subject matter expert. Whatever she tells you to do, you do it." The fire chief looked at Riley, taking in her ACUs, her sergeant stripes, the maroon patch on her shoulder. "You're the specialist?" "Yes, sir. You look young." "I'm 32. I've been doing this for 12 years if you count my training. Now, where are your critical patients?" He pointed to 3 separate triage areas. Red zone all 3. Riley was already moving. "I need full decon protocols established. No one enters treatment areas without proper PPE. Get me portable oxygen, bronchodilators, and corticosteroids. If you have CPAP units, get them ready. We don't has. Then improvise. Bag valve masks with PEEP valves. You have those? Yes. Good enough. Show me the first patient. She worked for the next 14 hours straight. 3 critical patients became stable. 9 moderate cases were treated and transferred. 0 fatalities. By the time the last patient was loaded into an ambulance, Riley's uniform was soaked with sweat. Her hands were raw from constant washing and glove changes, and her voice was hoarse from giving commands. But everyone lived. General Hayes found her sitting on the back bumper of a fire truck, drinking water from a bottle someone had handed her. Hell of a job, Sergeant. Riley nodded, too tired to speak. Hayes sat down beside her. You saved 12 lives today, plus the 12 from this morning at County General. That's 24 people who are alive because you refused to give up on them. Riley took another drink. You can't save everyone, Riley, but you can save the ones in front of you. That's all any of us can do. Riley looked at her hands, still steady, still sure. I think I'm starting to understand that, ma'am. Good. Hayes stood. Because I have an offer for you. Riley looked up. Come back, not to combat, not to deployment, to training. Teach the next generation of combat medics. Share what you know. Make sure fewer people lose their teams because their medic wasn't prepared. Riley was quiet for a long moment. Can I think about it? Take all the time you need. But Riley? Hayes met her eyes. Your team didn't die because you failed. They died because war is chaos, and sometimes chaos wins. But 43 other people lived because you were exactly where you needed to be, doing exactly what you were trained to do. She walked away, leaving Riley sitting alone in the fading light. Riley pulled out her phone. 3 missed calls from Dr. Webb, 2 texts from Jessica, asking if she was okay. 1 message from an unknown number. She opened it. Heard you got called back in. Bet you showed them what you're made of. Proud of you, Morgan. Always have been. Garrett. Riley stared at the message for a long time. Then she typed back. Thanks. I think I needed to remember who I was. The response came immediately. You never stopped being her. You just forgot for a while. Riley smiled, small and genuine. Then she stood, stretched, and looked back toward the treatment area, where 12 people were alive because she'd shown up. Maybe Hayes was right. Maybe it was time to stop hiding. Riley walked back into County General 48 hours later. She still wore her ACUs, dust on her boots, exhaustion written into the lines around her eyes. But she walked differently now. Head up, shoulders back, the invisible woman replaced by someone who'd stopped apologizing for taking up space. The emergency department was in the middle of morning rounds. Dr. Wedd stood at a nurse's station reviewing charts with 2 residents. He saw her first. He stopped mid-sentence, set down his tablet, and walked toward her. Riley. She stopped, waiting. The hallway went quiet. Nurses paused their conversations. Techs looked up from their computers. Within seconds, a dozen people were watching. Dr. Webb stopped in front of her. His expression was difficult to read, somewhere between respect and regret. I owe you an apology. His voice carried clearly through the silence. A serious one. Riley didn't speak. I treated you like you were invisible for 11 months. I assumed you were less qualified, less capable, less valuable than you actually were. I gave you menial tasks because I didn't bother to see who you really were. He shook his head slowly. You've been the most qualified person in this department since the day you started, and I had you restocking supplies and running lab samples. That was wrong. I was wrong. Riley's expression remained neutral. You didn't know my background. I didn't need to know your background to treat you with basic respect, and I didn't do that. He met her eyes directly. I'm sorry. The apology hung in the air, genuine and uncomfortable. Riley nodded once. Apology accepted. Jessica stepped forward from where she'd been standing near the medication room. Her eyes were red-rimmed, like she'd been crying recently. I'm sorry, too. Her voice shook. I said terrible things about you, called you boring and creepy, and said you had no personality. I made fun of you to other people. And the whole time, you were human, Riley supplied gently. Just human, same as you. But you saved all those people. You've done things I can't even imagine. And I was so cruel. You didn't know. That's not an excuse. Jessica wiped her eyes. You deserved better from all of us, whether you were a war hero or not. Riley was quiet for a moment. Then she said, I didn't come here to be treated special. I came here to do the work. You gave me that. That's enough. A tech spoke up from the back. It's not enough, though. We should have seen you. You see me now, Riley said simply. That's what matters. Dr. Webb cleared his throat. The hospital board met yesterday. They've reviewed your credentials and your service record. They want to offer you a position as a trauma attending physician, pending completion of the civilian certification process. Riley blinked. I don't have the required residency hours. You have 8 years of field experience that exceeds most trauma residencies in terms of case volume and complexity. The board is willing to fast-track your credentials and sponsor your certification testing. That's not standard protocol. You're not a standard candidate. He almost smiled. Riley, you performed procedures in the past 48 hours that some of our doctors have only read about. You organized a mass casualty response in minutes that most teams would need hours to coordinate. You saved lives using techniques that aren't even taught in civilian medical schools. He paused. We need you, not as support staff, as a leader. Riley looked around the department, the place she'd hidden in for 11 months, the place that was offering her something different now. If I accept, I do things my way. I train your staff in techniques you might not be comfortable with. I challenge protocols that don't make sense. I don't do politics or bureaucracy well. Webb actually smiled this time. I would expect nothing less. Then yes, I accept. The department erupted in applause. Riley looked uncomfortable with the attention, but she didn't hide from it either. 3 weeks later, the conference room was packed. 20 doctors, nurses, paramedics, and emergency techs sat in rows facing the front, where Riley stood beside a training mannequin. She wore scrubs now, with a white coat that had her name embroidered on it. Riley Morgan, MD, trauma attending. The certification had been expedited. The board exam passed on the first attempt with the highest score in the state that year. Good morning, Riley began. We're going to talk about trauma management in resource-limited environments. These are techniques developed in combat medicine that have direct application to civilian emergency care. She moved to the mannequin. First, hemorrhage control when standard equipment isn't available or isn't working. For the next 90 minutes, she walked them through procedures most had only seen in textbooks. Her hands were steady and sure, her explanations clear, her demonstrations precise. She taught them junctional tourniquet application, improvised chest decompression, alternative airway management. Dr. Webb watched from the back, taking notes like a medical student. A resident raised his hand. Dr. Morgan, how do you stay so calm when everything's falling apart around you? Riley paused, considering the question seriously. I don't stay calm, she said honestly. I feel the fear, the pressure, the weight of responsibility, just like everyone else. But I've learned that you can feel those things and still move forward. You don't wait for the fear to go away. You just move anyway. She looked around the room. The secret isn't being fearless. It's being more committed to the patient than you are afraid of failing them. The room was completely silent. You'll make mistakes. Everyone does. I've made plenty. Her voice was steady. But if you show up, if you try, if you refuse to give up on someone when it would be easier to quit, that's what matters. That's what saves lives. A nurse in the front row was writing frantically, trying to capture every word. Jessica raised her hand. How do you deal with the ones you can't save? Riley's expression shifted slightly. The question hit somewhere deeper. You remember them, she said quietly. You carry them with you, not as failures, but as reminders of why the work matters. And then you save the next one, and the next one. You keep going because stopping means more people die. She paused. I lost people I cared about. People I tried everything to save. For a long time, I thought that meant I didn't deserve to keep doing this work. But I was wrong. They didn't die because I wasn't good enough. They died because sometimes medicine has limits and we can't control everything. Her voice strengthened. What we can control is showing up, being prepared, refusing to quit. That's all any of us can do. And it's enough. The session ended to sustained applause. Afterward, Dr. Webb approached her. That was exceptional. Thank you. The board wants to make this a regular training series. Combat medicine integration, they're calling it. They want you to lead it. Riley nodded slowly. I can do that. There's something else. He pulled out a folder. We've had 17 applications from other hospitals asking to send their staff for training. Your reputation is spreading. That was fast. You saved 24 lives in one day, Riley. Word gets around. She looked at the folder, at the list of names and institutions, at the opportunity to share what she knew with people who needed it. Set up the program, she said. I'll teach anyone who wants to learn. That evening, Riley sat in her car in the parking lot, phone in her hand. She opened her messages and found the conversation with Garrett. She typed, "You asked me to call you 3 weeks ago. I'm ready now. Coffee this weekend?" The response came 30 seconds later. "Absolutely. It's good to have you back, Morgan." She smiled. Then she scrolled to another contact she'd been avoiding. General Hayes. "Ma'am, regarding your offer, I'd like to discuss a hybrid arrangement. Part-time consulting with Army Medical Command, focused on training rather than deployment. If that's possible." The reply took 2 minutes. "Very possible. Let's talk details. Proud of you, Sergeant." Riley set her phone down and looked at the hospital through her windshield. For 11 months she'd been invisible here, a ghost hiding from her past. Now she was building something new, not running from who she'd been, but integrating it with who she was becoming. She started the car. At home, she finally unpacked the box she'd kept sealed since her discharge 4 years ago. Inside, photos of her team. Martinez grinning at the camera, Chen making a ridiculous face. Daniels and Thompson arm in arm, both laughing at something off frame. She set the photos on her shelf, visible now instead of hidden. "I'm sorry I hid," she said quietly to their images. "I'm sorry I thought I didn't deserve to keep doing this. But I'm back now, and I'm going to make sure what I learned from you helps other people. I'm going to make sure your deaths meant something." She touched each photo gently. Then she went to bed without nightmares for the first time in 4 years. The next morning, she walked into County General Emergency Department as Dr. Riley Morgan, trauma attending. Jessica greeted her at the nurse's station. "Morning, Dr. Morgan." Riley smiled. "Morning, Jessica. What do we have today?" 3 stable patients, 1 incoming MVA, and a resident who needs supervision on a central line placement. "Let's start with the central line." Teaching moment. They walked together toward the procedure room. Colleagues now, equals in the work. Behind them, the emergency department hummed with organized purpose. And Riley Morgan, who had spent so long being invisible, was finally exactly where she needed to be. Seen, valued, home 6 months later. Riley stood at the podium in a lecture hall filled with 200 medical professionals. The banner behind her read, "Trauma Medicine in Austere Environments, Lessons from the Field." She wore her dress uniform. The maroon patch on her shoulder caught the stage lights, silver wings gleaming against the dark fabric. 2 bronze stars and a silver star formed a small row above her left breast pocket. The room was completely silent. "My name is Riley Morgan," she began, her voice steady and clear. "I spent 8 years as a special operations combat medic. I deploy 4 times to combat zones where the nearest hospital was hours away and the nearest trauma surgeon was me." She clicked to the first slide, a photograph of a field hospital, tents in the sand, medical equipment spread across rough tables. "I've worked in conditions most of you will never see. I've performed surgery with improvised tools under incoming fire. I've made life and death decisions in seconds with incomplete information. And I've learned something important." She paused, looking out at the audience. "The techniques that kept soldiers alive in war zones aren't just for war. They're for anyone who refuses to accept that a patient is unsavable when the system says it's over." Murmurs of agreement rippled through the crowd. "When I came home, I hid. I was afraid that the worst parts of my past would follow me, that I'd bring the violence, the trauma, the loss into civilian spaces when they didn't belong." She advanced to the next slide, the emergency department at County General. "But I was wrong. What followed me wasn't the worst parts, it was the best parts. The discipline, the precision, the absolute refusal to give up on a patient as long as their heart can be made to beat one more time." More slides now. Training sessions, procedures, success stories. For 11 months, I worked as support staff in an emergency department. I restocked supplies. I ran lab samples. I was invisible because I chose to be. because I thought I didn't deserve recognition after I'd failed to save my own team. The room was absolutely still now. But I learned something during those 11 months. The work doesn't need recognition to matter. The patient doesn't care about your credentials or your service record. They just need you to show up and refuse to quit. She clicked to a final slide, a simple list. Show up, stay calm, trust your training, never give up. That's it. That's the secret. There's no magic, no superhuman ability, just competence, commitment, and the willingness to keep moving when everything in you wants to freeze. She looked out at the faces watching her. You don't have to be a combat medic to save lives in impossible situations. You just have to be someone who shows up when it matters and does the work regardless of the obstacles. The applause started before she'd even stepped away. Why from the podium? It continued for a full minute. Afterward, a line of people waited to speak with her. Residents, experienced physicians, paramedics, nurses, all wanting advice, guidance, just a moment of her time. A young EMT approached, maybe 25, her eyes bright with unshed tears. Dr. Morgan, I just wanted to say thank you. I've been struggling lately, feeling like I'm not good enough, like I don't belong in emergency medicine. Riley met her eyes directly. Why do you feel that way? I don't know. Imposter syndrome, I guess. I see people like you who've done incredible things and I think, how can I ever measure up to that? Riley was quiet for a moment. Then she said, you're not supposed to measure up to anyone. You're supposed to be competent at your level, committed to your patients, and willing to learn. That's enough. But you saved so many people. One at a time, Riley interrupted gently. I didn't save hundreds of people all at once. I saved one person, then another, each time doing the best I could with what I had. That's all any of us can do. The EMT nodded, wiping her eyes. Thank you. I needed to hear that. You're going to be fine. Trust yourself. Outside the lecture hall, the sun was setting over the city. Riley stood on the steps, breathing in the cool evening air. Her phone buzzed. A text from Jessica. Dinner tonight? The whole team wants to celebrate your promotion to Director of Trauma Services. You can't say no this time. Riley smiled and typed back. Okay, but nowhere fancy. Another message, this one from General Hayes. Excellent lecture. Your training program proposal has been approved by Medical Command. We'll discuss implementation next week. And one more, from Garrett. Saw the video of your speech. Made me proud. Made the whole unit proud. You're doing good work, Morgan. Riley pocketed her phone and looked back at the building where 200 people had just learned techniques that might save lives someday. In her bag, tucked beside her stethoscope and tablet, the maroon patch rested. No longer hidden, no longer a source of shame, just a part of her history that had shaped who she'd become. She thought about Martinez, Chen, Daniels, and Thompson. She thought about the 43 soldiers in Helmand who'd lived because she refused to let them die. She thought about the man with the femoral bleed, the child with the head trauma, the 12 chemical exposure victims. She thought about every patient she'd saved in the past 6 months at County General, and every student she'd trained who would go on to save others. The work rippled outward in ways she'd never fully see or understand. But it mattered. All of it mattered. Riley descended the steps and walked toward her car. Tomorrow, she'd be back in the emergency department, teaching residents, treating patients, continuing to build something meaningful from the wreckage of her past. But tonight, she'd have dinner with people who saw her, really saw her, and valued her for exactly who she was. A week later, Riley stood in a different kind of room. County General had converted an unused conference space into a permanent training facility. Medical equipment lined the walls. Simulation mannequins lay on gurneys. Whiteboards covered in anatomical diagrams filled every available surface. Above the door, a new plaque. Morgan Center for Combat Civilian Medicine Integration. Dr. Wedd stood beside her, looking at the space with visible pride. The board voted unanimously. They wanted your name on it. Riley shook her head slowly. I don't need my name on anything. It's not about what you need. It's about what this represents. You changed this hospital. You changed how we think about trauma care. Students will train here for years, and they'll know it started with someone who refused to give up. It didn't start with me. It started with everyone who taught me. Every combat medic who shared their knowledge. Every surgeon who trusted me with a scalpel. Every patient who survived long enough for me to learn from my mistakes. Wed smiled. Then consider this your way of passing it forward. The first class began an hour later. 15 participants, ranging from paramedics to experienced trauma surgeons, all eager to learn. Riley stood at the front, comfortable now in the role of teacher, no longer hiding her competence or her past. Welcome to Combat Civilian Medicine Integration. Over the next 2 weeks, we're going to cover trauma techniques that can save lives when standard protocols fail or resources are limited. She moved to the first mannequin. We'll start with hemorrhage control in non-compressible areas. These are the injuries that kill people in the first 10 minutes. These are the situations where knowing one additional technique means someone lives instead of dies. Her hands move with practiced precision, demonstrating tourniquet placement, pressure points, improvised hemostatic control. The key is simple. You stop the bleeding. Everything else is secondary. Airway, breathing, circulation, yes, they all matter. But if your patient exsanguinates in 3 minutes, none of the rest matters. She worked through the demonstration, explaining each step, answering questions, correcting hand positions with gentle guidance. Jessica was in the class, taking notes like her life depended on it. So was the young resident who'd asked Riley how she stayed calm. So was Staff Sergeant Chen, who'd enrolled in a civilian EMT program and wanted advanced training. Dr. Morgan, one participant asked, how do you deal with the pressure of knowing someone's life depends entirely on what you do in the next 60 seconds? Riley set down the training equipment and looked at him. You remember that pressure exists whether you acknowledge it or not. The patient is dying either way. Your fear doesn't change that. Your hesitation doesn't change that. The only thing that changes the outcome is action. She paused. So you feel the pressure, you accept it, and you move anyway. Because moving gives them a chance. Freezing gives them nothing. The class continued for 6 hours. By the end, every participant had successfully performed procedures they'd been afraid to attempt at the start. Chen approached Riley as people were packing up. Man, I just want you to know, this program, what you're building here, it's going to save a lot of lives. That's the idea. More than that, though, it's giving people like me a second chance to serve. I can't deploy anymore, but I can learn from you and take that knowledge back to my community. Riley smiled, genuine and warm. You never stopped serving, Sergeant. You just found a different way to do it. He nodded, emotion clear in his eyes, then left. Riley stood alone in the training center, looking at the equipment, the diagrams, the space dedicated to tassing forward everything she'd learned through pain and experience. Her phone rang. General Hayes. Sergeant Morgan, I have a question for you. Yes, ma'am. How would you feel about expanding this program nationally? Army Medical Command wants to establish civilian training centers at 6 major hospitals. You'd oversee curriculum development and instructor certification. Riley looked around the room. I'd say yes, on one condition. What's that? We name it after my team. The Martinez-Chen-Daniels-Thompson Combat Medicine Training Initiative. Silence on the other end. Then quietly. I think that's perfect. Riley closed her eyes. Thank you, ma'am. Thank you, Riley, for coming back, for not giving up, for turning your loss into something that will save countless others. After the call ended, Riley sat down on one of the gurneys. She pulled out her phone and looked at the photo she kept there now, her team. All 4 of them, smiling in the Afghan sun. I hope this makes you proud, she whispered. I hope you know I never forgot. I never will. The room was quiet, but it didn't feel empty. Riley stood, turned off the lights, and locked the door behind her. Tomorrow, more students would arrive, more techniques would be taught. More lives would be saved by people she'd never meet, in situations she'd never know about, because knowledge rippled outward in infinite directions. She'd spent 4 years hiding from her past. Now she was building a future from it. And somewhere, she believed, Martinez and Chen and Daniels and Thompson were watching, proud, at peace, knowing their deaths had not been meaningless. Riley walked through the hospital corridors, past the emergency department where she'd once been invisible, past the nurses' station where colleagues now greeted her by name, past the trauma bays where she saved lives every single day. She pushed through the front doors into the night air. The city stretched out before her, full of people who would need help someday, and she would be ready. because that's what she did. She showed up, she stayed calm, she trusted her training, and she never ever gave up.